Hello parents, this is Dayna. I'm going to touch on the identity issues of our child after we diagnose them. There are two schools of thoughts about if we should be open about our child's diagnosis if they happen to be on the autism spectrum or some other labels. Some will feel that our child do not need any differential treatment. Without labeling them, they would be treated just like any mainstream kids socially and publicly. This usually works well in a society for a community where public acceptance and knowledge of special needs are high. But not all communities might have that knowledge. Another school of thought is the child might need certain privilege and help and be recognized that he is special. I think these issues also pertains a lot to the different functioning level of the child before we can really decide on the best scenario. I personally decided on educating my child that he has autism when he's about between 8 to 10 years old, and I started talking to him about he is suffering from autism because he already have a reasonable amount of communication ability using language at that period. I like my child to embrace himself the way he is. I ensure him that his condition is not going to be a hindrance to the love the family and myself have for him, and he's growing and developing as an individual. If he works hard, he would still be able to access to all the learning environment that other children have. However, there would always be social and learning differences with different dynamics in different countries and communities. There is no right or wrong choice as to how we should handle identity of our child and how we present them publicly or to the extended family. There's definitely a lot to do in public education on special needs acceptance, especially so in Asia, in my opinion. It is easier to start within ourselves. Thus, on the choices of educating my own child about his condition, despite him fully understanding the impact of how autism might or would affect his life, that would take him to a longer and deeper self-acceptance in the long run. He is able to narrate to others about his condition and is labeled as an autistic person when he gets into trouble at times. He goes to the doctor and he tells the doctor he has autism. And he sometimes wittily let his teacher know he has autism when he tries to be silly. This is very closely related how our mindset affect on how we can actually take this more lightheartedly. I'm referring to higher functioning kids who can verbalize and have language communication to be able to express their self-condition. Then again, like what I said earlier, there is no right or wrong answer on how we want to help our child who is on the spectrum to actually identify themselves, as each family faces unique situations. It is most important to, however, look at the positive side on how to embrace autism and grow together with our child and their label. A positive mindset leads to a positive future. Please subscribe to my channel and press the subscribe bell for more and latest video.